how long is the recovery from a laparoscopic procedure, for example, from endometriosis excision? This is probably the most common question that we're asked, understandably, by patients who are undergoing surgery. But it's a question that is difficult to answer because it depends what we mean by recovery. Most of our patients go home either the same day or the next day after surgery. If you've had a more complex procedure like bowel resection, for example, you may need to stay in hospital for a bit longer, usually around 3-4 days. After the first day, normally we'll encourage you to get out of bed and walk around. So some people will see that as the important point of recovery. But some mean other things by how long is the recovery. How long will it take for you to be completely normal like you were before surgery? I think that's what most people mean when they ask the question how long the recovery takes. I would say something between 2 to 6 weeks is a good guide. The rule of thumb is to have a backup plan, have plans in place, at least for the first 6 weeks, because the recovery could vary from person to person, and it could vary depending on the complexity of the operation and whether or not everything went smoothly and with no problems. After a day or two, you should be able to do your normal activities at home. You should be able to get up and make a cup of tea. You should be able to walk around the house comfortably. You may have some pain at this stage, and we'll send you home with painkillers to help with that. If you have little children, it would be a good idea to have someone helping you. It may be painful to lift your little child, for example, and it would be important to have someone to help you around the house, your partner, or a parent or a friend.